Vision is such an essential part of our lives. So much of what we do and enjoy depends upon the ability to see clearly. So if your vision begins to fail, it can cause great anxiety. But if you understand what is happening with your vision, you gain a sense of control over the situation, providing some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called age-related macular degeneration, also known as AMD. To understand how AMD affects your vision, it's important to understand how the eye works.
Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It is the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see details clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older.
There are two forms of AMD. One is called atrophic, or dry form. The other is called exudative, or wet form. About 90% of patients who get AMD have the dry form.
The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the retinal pigment epithelium, or RPE, is affected by deposits, called drusen, as well as other age-related changes. These changes may cause vision to deteriorate.
Many people don't realize they have macular degeneration until they notice a problem with their vision, or until AMD is detected during a regular eye examination.
I was just going to my eye doctor because it's something I do every 2 years. Again, to see if I need a little stronger prescription. And what's interesting is that my prescription hadn't changed at all in 6 years. It's pretty much the same prescription. So when she told me 2 years ago that she wanted to send me to a specialist, that I was a little surprised because I didn't have any idea why.
Many people develop dry AMD as they age, and in many cases it's very mild. However, the disease can progress to more advanced stages. People at high risk for developing later stage or wet macular degeneration are those with intermediate AMD in both eyes or advanced AMD in one eye. Scientific research shows that among those people at risk for advanced AMD, taking dietary supplements of vitamin C, vitamin E, and beta-carotene along with the mineral zinc lowers the risk of developing more advanced AMD by about 25 to 30%.
Well, when I saw my ophthalmologist the very first time, he recommended that I take a vitamin. You know, this is going to help either slow down the process or improve the situation with my dry AMD. I was willing to try it, obviously. I mean, I had everything to gain and nothing to lose, and I've been taking the vitamins now for a little over a year.
Your ophthalmologist can tell you if you're at risk for developing advanced AMD and if supplements are recommended for you. At any stage of AMD, ophthalmologists encourage their patients to closely monitor their vision every day for any sign of changes. A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to detect changes in your central or macular field of vision. You simply sit in a well-lit area and hold the grid away from you at a comfortable position. If you wear glasses, you should keep them on. Cover one eye and look directly at the point in the center of the grid, but observe the pattern of vertical and horizontal lines in your peripheral vision. Then do the same with the other eye. Typically, a visual abnormality due to AMD would cause some of the straight lines to appear wavy or blurry, or areas to appear dark or even blank. If you notice any new changes in the grid, you should contact your ophthalmologist immediately. If a person with dry AMD notices changes when they use the Amsler grid, this can be a sign that wet AMD is developing. Detecting wet AMD as early as possible is critical for seeking treatment and minimizing visual loss.
With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 10% of people with macular degeneration have the wet form.
I was looking at my plantation shutters, and they were like crooked. And I thought, all that money and they're crooked. So I realized when I covered each, like this eye and then this eye, I realized, oh no, it's not the blinds, it's me. So got on the phone, called the doctor, and they saw me immediately and sent me on to the retinal specialist, and that's when it was diagnosed.
One of the most important factors in treating wet AMD is early detection. Although it may be impossible for your ophthalmologist to predict if you will get wet AMD, using the Amsler grid on a regular basis can help to detect vision changes as early as possible. If your ophthalmologist suspects macular degeneration, diagnostic techniques such as fluorescein angiography and optical coherence tomography, or OCT, are used to help identify what's going on with the macula. Fluorescein dye is injected into a vein in your arm, and the dye travels to the blood vessels in the eye. A special camera is used to photograph the retina and blood vessels, which are illuminated with dye. These images provide a map of problem areas and help your doctor identify appropriate treatment options and monitor their effectiveness. For some people with wet AMD, there are treatments available. While they aren't cures, these treatments can help stop the progression of blood vessels, which, if left unchecked, could lead to significant loss of central vision.
It's my understanding you'll never be totally blind. As I said, my mother had it till she was 89, so at least 20 years she had it, and she was still functioning.
If a fluorescein angiogram shows us the abnormal blood vessels are not directly under the central macula, it may be possible to treat them with standard laser therapy.
With laser therapy for wet AMD, the pupil is dilated using drops, and an anesthetic is given to numb the surface of the eye and in some cases to keep the eye from moving. A special contact lens is placed on the surface of the eye to help the surgeon see the retina. A high-energy laser beam is aimed at the tiny leaking blood vessels to seal them and to help stop them from growing. It is important to stop the spread of these vessels as quickly as possible, but depending on how close they are to the center of the macula, the patient may experience some further permanent blurring or loss of vision after the procedure. Of the patients with wet AMD who have the standard laser procedure, it is likely that 50% of them will need a retreatment within 3 to 5 years.
Another form of treatment for wet AMD targets a specific chemical in your eye. This chemical, called vascular endothelial growth factor, or VEGF, is critical in causing abnormal blood vessels to grow under the retina. Several new drugs have been developed that can block the trouble-causing VEGF. An anti-VEGF drug can help reduce the growth of abnormal blood vessels and slow their leakage, which helps to slow vision loss and in some cases may even improve vision.
The anti-VEGF drug is administered directly into the eye in an outpatient procedure. After the eye has been numbed with an anesthetic, the anti-VEGF drug is injected into the eye with a very fine needle.
My ophthalmologist recommended that I get medication injected into my eye as a way to stop this from getting worse, which they did, and actually it didn't get any worse.
Patients may receive multiple anti-VEGF injections over the course of many months. Research indicates that anti-VEGF injections can keep vision from getting worse in a large majority of patients with wet AMD, and for some can even improve vision.
In some cases, anti-VEGF treatment may be combined with other therapies. For instance, some patients may also receive a treatment called PDT, or photodynamic therapy.
This procedure uses a combination of a light-activated drug and a special low-power or cool laser. The photosensitive drug is injected into the patient through an intravenous infusion and travels to the abnormal vessels behind the central macula. The drug attaches to molecules that are commonly found in rapidly growing cells, such as those in wet AMD blood vessels. A low-powered laser light is focused directly on the abnormal vessels, which activates the drug, causing damage specifically to the unwanted blood vessels. Usually multiple treatments are required.
It's important to remember that only about 10% of all AMD cases are the exudative or wet form. Some of these wet cases may not be treatable or may not respond to treatment, but people with untreatable AMD won't become blind. They will still have peripheral or side vision.
I used to play a lot of tennis, and this was an established tennis game on every Friday. And in this particular moment, I looked across that court, and every line, the painted lines, the horizontal line of the net, wavy as can be. I'm looking at your face, and there's no face there. There's no central dimension to your body. But if I move my head one way or the other, just slightly, that I still can't see your face, but your arms and your shirt and how you're seated, that's clear enough to me. This little person looks like one of my granddaughters, about 11, Leah. What I see is a posture or a kind of a semblance of something recognizable. Nothing specific enough so I could identify it for you.
With the vision rehabilitation techniques and low vision tools and devices available today,
2:22 p.m.
See, that's big enough for me to...
people with advanced AMD can learn to use their remaining vision quite effectively.
So I know it's on at 7 o'clock. I know what I'm going to be doing tonight at 7.
Macular degeneration is a very common vision problem. While we do not know how to prevent or cure this condition, we are learning more about it. Researchers are continually evaluating new forms of medical, surgical, and laser treatments. With early detection, we can often help slow down visual loss and preserve sight. And with our newer treatments, in certain cases, vision can even improve. If you have AMD, understanding your condition and being vigilant about monitoring your vision can help you successfully maintain your quality of life.